Welcome to Daily Series, COVID-19 Special. Brought to you by HealthyRN Ways. During COVID-19 pandemic, what can we do to keep our healthy visit to the clinic? Ob-Gyn wellness visit because of the pandemic. Tips on how to get the most out of a telemedicine appointment with a gynecologist. A telehealth visit with your Ob-Gyn might be more productive than you think. The pandemic has ushered in a new normal, and part of that involves managing almost every aspect of life without leaving home, adding an extra layer, or two, of complication and stress to our routines. It's more important than ever to make sure you're taking time to care for yourself by eating healthfully, finding ways to be active, and getting plenty of sleep. Staying up to date with well-woman visits and screenings is a critical part of staying on top of your health, too. If you've been considering deleting your annual Ob-Gyn visit from your calendar because of COVID-19, you may want to think again, especially if you have any issues you need to discuss with your doctor. Most Ob-Gyn practices and Planned Parenthood are offering virtual wellness visits and help with issues like UTIs, birth control, and STD treatment by video chat or telephone. Similarities between telemedicine appointments and in-office appointments. The truth is that in many ways a telemedicine appointment is not that different from a regular appointment. There is value in doing a virtual visit if your doctor is offering it. It's a good way to touch base if you have concerns or if you're worried that you may potentially have something serious going on. Ob-Gyn offered a virtual appointment. A physician a message to each patient to give them the option to do their annual visit virtually. We don't know how long this is going to go on, and many people may not want to wait another full year to have their issues addressed. So far about 50% of patients are scheduling a virtual visit. A telemedicine appointment is a way to talk through things. Even though there are some screenings and procedures that obviously need to be in person, much can be accomplished through these appointments. Reproductive health issues can be treated virtually. Birth control. You don't need an in-person visit to be prescribed birth control pills, especially if you're an established patient. Planned Parenthood offers help with managing your birth control, including emergency contraception, through telehealth as well. Urinary tract infections. In a perfect world you'd have a culture to test for UTI, but this isn't a perfect world right now. This diagnosis can often be made via telehealth without an office visit. In most cases, talking to your doctor before spending money on a UTI test from a pharmacy. If a patient tells that she has to pee every 2 seconds, there's blood in her urine, and it hurts like hell, no need for her to go out and buy a kit to tell her she has a bladder infection. Sexually transmitted diseases, STDs. If someone needs a sexually transmitted disease, STD, screen, that's not going to happen in a telehealth visit. You can talk about symptoms and concerns, and keep in mind that some doctors' offices are open for testing. There's also a lot of outpatient walk-in clinics if you're concerned about a sexually transmitted infection. You don't need a gynecology exam to determine if you have gonorrhea or chlamydia, you just need a urine test. Abnormal cervical mucus. The most common causes of excess cervical mucus and irritating vaginal symptoms are either a yeast infection or bacterial vaginosis. A lot of women think they're pretty good at figuring out whether it's a yeast infection or bacterial vaginosis, but the studies show that's not true. Although a test in the office is the way to a definitive answer, often your provider can help by asking questions. What does the discharge look like? What color is it? Is there an odor? You may be able to treat it with an over-the-counter medication, but if your symptoms don't go away you may need an antibiotic or an office visit. Rashes, bumps, and other uncomfortable issues. At the vulva clinic, women often present with painful rashes, burning, or bumps. This can be miserable. These conditions can be discussed in a telehealth appointment, and often patients are more than happy to use their camera to show the provider what the issue is. Hormone therapy. You often don't need an in-person visit to make adjustments to hormone therapy. Discuss the changes in hormone therapy with a patient. After knowing the symptoms and what was going on, some adjustments made to her therapy, and scheduled a follow-up appointment in 2 weeks. The recommendation or the value in the visit wasn't impacted by the virtual nature of the appointment, though that's not always the case. Abnormal bleeding. If you're having problems with your period, whether it's cramps or spotting or irregular bleeding, you don't always need a test or an exam. It's helpful in many cases, but you don't know that until you have the conversation. And, if your doctor determines you need a test, you'll be able to get it. Problems that requires in-person visit. You may need to be seen right away for urgent issues such as a fever or vaginal infection that is unrelated to COVID-19, symptoms of an ectopic pregnancy, including pain in the pelvis, abdomen, or lower back, issues due to a recent surgery or procedure, or severe vaginal bleeding. Non-urgent elective surgeries may also be delayed for weeks or months because of the pandemic. Your doctor will be the best source of information to determine the status of your procedure or surgery if you have one currently scheduled. Frequently asked questions about telehealth and gynecology. Should I do a video or audio call? Most offices that are offering telehealth leave it up to the patient whether they want to do a video call or an audio call. Patients has the option of a video chat or a regular phone call when they make the appointment. Some findings overall is that people who are using Zoom routinely for their own work actually prefer it. They feel like it's a more in-person encounter, whereas someone who is not familiar with it usually opts for the phone call. If you're new to Zoom or whatever platform you are using, try it out in advance. Don't wait until the time of your appointment to start experimenting with it. There might only be 15 minutes allotted for that appointment, and if you spend 10 of those trying to figure out how to use the technology, your time is gone. Is a virtual doctor visit like a regular appointment? Even though the appointment is virtual, the commitment is real, and you should be at your computer ready to go at the time of your appointment. Some people might think, I'm 5 minutes late. What difference does that make? If you're not picking up at your appointment time, the provider is going to go on to the next appointment. You have an allotted amount of time just as you would in the office, and so it's a good idea to figure out the major concerns you want to discuss and have any questions ready ahead of time. Can I do a telemedicine appointment if I'm a new patient? Although you can schedule a telehealth appointment at many clinics, including Planned Parenthood, keep in mind they may not have access to your medical history during your visit. A telemedicine appointment with an established patient. It helps if physically examined her in the past, and familiar with her health history and issues. During the appointment, have access to her chart so that it can be seen what was done up until now. That's very different from seeing a new patient. We can do more with an established patient. Can I get a new prescription? You can get a prescription filled or refilled via a telemedicine visit. If we're not seeing a patient virtually, we're extending. Normally we would re-evaluate things like hormone therapy or birth control in an annual visit, but now we're extending for 3 months, so continuing their prescriptions, with the understanding that we'll touch base with them in a few months to see how they're doing. If you are sheltering in place somewhere other than your normal residence, keep that in mind if your doctor prescribes any medications. Unless you specify otherwise, the prescription will get called in to your usual preferred local pharmacy. What to do about missed screenings, expiring IUDs. People get nervous about something with a due date or expiration date like a mammogram, Pap test, or an IUD. If you're concerned, check in with your provider. In many cases, there's a lot of wiggle room, such as with IUDs, intrauterine devices. If you're supposed to come in for an exchange because you've been told the 5 years is up, that's clearly not something you can do over the phone. The good news is, many studies show that you can leave it in for a year longer and sometimes even 2 years. Some of that depends on your age, because a 25-year-old woman is more fertile than a 40-year-old, but we have really good studies that show it's okay to let your IUD go another 6 months without replacing it. In cases where you need a follow-up or a scheduled screening, the level of urgency can depend on many factors, such as your age and health history. There are situations where waiting a few months is perfectly fine. If you're concerned or even just questioning if something is serious, it's good to call your doctor and see if it can wait, and if so, for how long. We're not sure how long these precautions with COVID-19 are going to be going on. Sometimes putting something off for a month is no big deal, but putting it off for 6 months, that could be a bit of a problem. Don't assume your doctor cannot see you. Keep in mind that most offices are still seeing patients, but often with a reduced schedule. Scheduling in-person tests and appointments a few days a week for patients who need to be seen right away. They get screened at the door, they get their temperature taken, and everyone is wearing masks. Everyone is being very careful with personal protective equipment. If you like this video, hit like, share and subscribe. Thanks for watching. See you on my next video. Ma salam.